Hey, this is Nurse Ben, back with another topic. Today we will be discussing different types of shock. Let's get started. What is shock? Shock is the inability of the heart and lungs to satisfy the oxygen and metabolic requirement of body tissues. An imbalance in oxygen supply and demand will lead to hypoxia. Without treatment, stages of shock begin, which we will talk more about in the video. 1. Hypovolemic shock. This is when our blood volume is not sufficient to get to our tissues and our organs. Decreased cardiac output. It is caused by acute bleed from gunshot wounds and knife injuries, damage to liver, ruptured aorta, or femur fractures, or severe gastrointestinal bleeds. Or it can also be caused by rapid fluid loss, from extensive burns, and severe vomiting and diarrhea. But the most common cause of hypovolemic shock is acute bleed. There are 3 goals in treating this situation. 1. Maximizing oxygen. 2. Initiate fluid resuscitation. 3. Treat underlying cause, which is to identify and control further loss of blood or fluid. 2. Cardiogenic shock. Acute deterioration of heart muscle contraction. In cardiogenic shock, the heart is the barrier. We got volume but heart cannot pump it. It results in decreased cardiac output and poor perfusion at the tissue level. Risk factors: acute myocardial infarction, end-stage congestive heart failure, and cardiomyopathy. Clinical manifestations include chest pain, diaphoresis, nausea and vomiting, hypotension, decreased level of consciousness, decreased urine output, poor pulses, pale and cool skin, hypoactive bowel sounds, shortness of breath, crackles, hypotension and bradycardia, and organ failure. Treatment. Main goal is to restore the blood flow to the myocardium. 1. Restore oxygenation. 2. Improve cardiac output by norepinephrine, dobutamine, nitroglycerin. 3. Identify the cause by doing chest X-ray, EKG, cardiac enzymes. 3. Obstructive shock. With obstructive shock, something is obstructing or getting in the way of blood going into and out of your heart or great vessels. Mechanical barrier to ventricular filling and ventricular emptying. It results in decreased cardiac output and poor perfusion at tissue level. Impaired filling disorders may include 1. Cardiac tamponade. It's the compression of the heart by an accumulation of fluid in the pericardial sac. 2. And tension pneumothorax. Tension pneumothorax occurs when air accumulates between the chest wall and the lung and increases pressure in the chest, reducing the amount of blood returned to the heart. Impaired emptying disorders include 1. Pulmonary embolism. A pulmonary embolism is a sudden blockage in your pulmonary arteries, the blood vessels that send blood to your lungs. Clinical manifestations may include 1. Decreased level of consciousness. 2. Decreased urine output. 3. Poor pulses and pale, cool skin. 4. Hypoactive bowel sounds. 5. Muffled heart sounds. 6. Jugular vein distension. Treatment. 1. Restore oxygenation with 100% non-rebreather. 2. Identify cause early and determine treatment ASAP. Administer medications such as vasopressors, thrombolytics, or anticoagulants. Distributive shock. In distributive shock, vessels are not working properly to get the blood from the heart to the tissues and organs. Poor vascular tone and vasodilation results in 1. Venous pooling. 2. Decreased venous return to the right heart. 3. Hypovolemia occurs due to vasodilation. Result of conditions such as 1. Sepsis. 2. Anaphylaxis. 3. Neurogenic shock. Neurogenic shock. Neurogenic shock is a combination of both primary and secondary injuries that lead to loss of sympathetic tone and thus unopposed parasympathetic response driven by the vagus nerve. Vessel walls relax and dilate because of the parasympathetic nervous system. As a result, blood pressure, heart rate, and cardiac output decrease. Cause: head injury, trauma to the spinal cord, and spinal anesthesia. Clinical manifestations may include hypotension, bradycardia, temperature dysregulation, dry and flushed skin, and autonomic dysreflexia. Treatment: 1. Resolve the underlying cause of the shock. 2. Fluid resuscitation to increase the blood pressure. 3. Medications to increase the blood pressure. Anaphylactic shock. It is an acute, life-threatening systemic hypersensitivity reaction. It can happen with food, medications, bee stings. Clinical manifestations may include shortness of breath, tachycardia, wheezing, stridor, cyanosis, confusion, tachycardia, hypotension, cool, pale, clammy skin, angioedema, flushing and urticaria. Treatment: 1. Assess the airway and maintain maximum oxygenation. 2. Intramuscular epinephrine. It stops the inflammatory process from happening, so we give it right away. 3. Administer medications such as antihistamines, corticosteroids, or inhaled bronchodilators. This is a short explanation of the different types of shock that are important for the NCLEX and nursing exams. We hope you found it helpful. If you have any feedback or suggestions on how we can make our videos better for your learning, please let us know in the comments. Don't forget to subscribe for more educational videos.